Yeah, thanks, Jorg. Good afternoon, everybody. As Jorg just said, I'm Ned from Autistica, where I'm the research and partnerships manager. And today I'm talking about the Autism Highlight Notice, which is part of the RfSC. Cool. So just a bit of background on Autistica. We are the UK's autism research charity, and we fund research based on the priorities of the UK's autism community. And through this approach, we've known for a number of years for the need for better social care for autistic adults. And it is our goal to aid this through research. So we've taken a number of steps over the past few years to begin to achieve this goal. In 2019, we hosted a social care summit involving community members, researchers, and social care professionals who came together to define areas for autism social care research to focus on, producing a report detailing these areas alongside ways that these could be researched. Second, we've commissioned a scoping review of autism social care research to understand and establish key gaps in the literature. And finally, we have partnered with NIHR over 3 years to fund autism social care research, which is what I'm talking about today. So the partnership with NIHR will, like I say, last for 3 years and will primarily involve the Research for Social Care Call and particularly the Autism Highlight Notice. This highlight notice aims to encourage project proposals with a specific focus on social care and autistic adults, and researchers can seek up to £100,000 on top of the £350,000 made available by NIHR, meaning that the limit for applications under the highlight notice is 450k. Now, this highlight notice, as I say, will be part of the call over the next 3 years, and Autistica are willing to provide up to £500,000 of funding over its course. And although I will discuss areas of social care, Autistica are keen to see explored and addressed through the research. Applicants have considerable flexibility to focus on any area or topic concerned with autistic adults who access social care. Now, there are a number of approaches to research that Autistica encourages as an organisation, and particularly within the scope of the highlight notice. First, as has been discussed on a few occasions today, we're an organisation that encourages the development of early career researchers, and we'd welcome applications based on the research ideas of ECRs, as well as them being included as either lead applicants or joint lead applicants. Second, applicants should demonstrate how their projects have and will involve the autism community and other key stakeholders, such as service commissioners and providers. Considerations should include developing partnerships with relevant organisations, as well as involving autistic people across all stages of the research. Third, we encourage national collaboration between researchers and research institutes working in interdisciplinary approaches and across interdisciplinary fields. And finally, many autistic people that access social care are commonly excluded from research, such as autistic people with profound learning disabilities or older autistic people. And so we encourage research projects that focus on issues important to such groups. Now, as I mentioned earlier, Autistica have gone through a number of priority setting exercises to identify important issues facing autistic adults who access social care. And I'm just going to mention a few here alongside some kind of potential research projects that might address these areas. So first of all, housing and homelessness. We know that autistic people are disproportionately represented in the homeless population. So projects here might explore the experiences of autistic people that are or were homeless. They might identify autism-specific pathways or challenges that led to these circumstances. And they might try and explore appropriate support approaches for autistic people in the homeless population. Translations. Now, although we know that change can have a profound impact on autistic people, there's a lack of knowledge and understanding of how autistic people that access social care should be supported through key transitions in adulthood. This includes the notable transition to adulthood, but also less commonly discussed transitions, such as changing in living circumstances, experiences of bereavement, or age-related changes in health. Here, there's a scope for a range of research projects, such as identifying what support does and does not work, investigations into how transition plans correspond to NICE guidelines in practice, and exploring how autistic people can have greater degrees of choice around transitions. Finally, staff training. This impacts autistic people across social care, yet there remains a lack of evidence as to what constitutes high quality training. Projects might ask what methods of training are most effective at improving the quality of care and support provided to autistic people. Are some methods of training more suited to specific groups within the autistic population? Could adaptations be made to methods of training to make them more appropriate to specific groups? And what autism training should be employed in non-autism specific services, such as mental health or addiction support services? Now, to note that all the social care priority setting exercises that Autistic have completed are available through our website, and I've provided links on these slides here, which will be shared after today's webinar. And it's also worth noting that each spring, through the partnership with NIHR Autistica, are running seed funding rounds, in which we are providing up to £10,000 for researchers to develop proposals for the RfSC call. So this year we funded 3 different projects for researchers who'll be submitting proposals. And once again, you can find out more about this seed funding through the provided links. Thank you very much.
Thank you very much, Ned. Very helpful and interesting to see this development. There were some questions, I think, in the chat. I'm not sure, Stacey, have you monitored it more closely? Mm-hmm. But if there is anybody wants to, raise their hand, do use the facility at the bottom. It's usually, I think, at the bottom of the screen for raising your hands under reactions. Stacey, did you?
Yeah, so just picking up on the questions in the chat, there's some questions around the remit. So one question is this autistic adults exclusively, or adults with autism alongside adults with other disabilities?
Autistic adults with any co-occurring conditions, or any person that has an autism diagnosis and that accesses social care.
Topping it up.
And another question around the long-term or ongoing relationship with Autistica. What should be expected or offered if a project's awarded under this highlight?
So so in terms of kind of what that'll look like, so there's the additional funding available, and then we're, because this is the first time we've done this, we're still figuring that out, but definitely we'll be making sure that they have that close relationship with Autistica to kind of maximize the value of the project as well.
And there were some questions around the seed funding, and if there's any more information about that, perhaps links that could be added in the chat, that would be really helpful.
Yeah, I'll pop a link in the chat now.
Thanks. And if we have time, there's one more question just come through. So the question is there a particular reason funding is only for adult social care?
Yes. So basically at the moment, that is because NIHR Research for Social Care is funded by the Department for Health and Social Care, and the Department for Health and Social Care is responsible for funding the NHS and adult social care. But if you're looking at children's social care, that is funded by the Department for Education. So a lot of our role is to kind of work with the department to make sure any findings from the research we fund goes to the department. So at some point there might be more of a kind of the decision kind of lies, I suppose, at that departmental level rather than our level in terms of funding, but I know there are conversations going on. So hopefully that is something that we'll be able to look at again at the future.
Okay, thank you.